Have you ever heard of R.O.M.E? And I don't mean the city, but as in a method to help in interpreting or deciphering ABGs. Actually, it's called the R.O.M.E method. That's what the topic of today's video is about. Hi there, welcome back or welcome to my YouTube channel. My name is Nurse Master Charlie, and I am a registered nurse, and on my channel I talk about and share about nursing related topics and tips, as well as health related topics, tips, and information. Like I mentioned, today's topic is on that of ABGs and their interpretation. I'm going to share about what ABGs are and, more importantly, how to interpret them. And in this video, I will be using the R.O.M.E method to interpret them. This is part 2 of a 4-part series. In part 1, I used the tic-tac-toe method. I'll leave a link in the description so you can check out that video. Then in part 3, once ABGs can be interpreted, I will be discussing about understanding fully compensated, uncompensated, and partially compensated ABGs. Let's first discuss what is an ABG. ABG is the abbreviation for arterial blood gas. An arterial blood gas, or ABG, is an arterial blood test that is obtained from an artery that measures the amounts of arterial gases such as oxygen and carbon dioxide within the blood. It is a common lab test to assess the overall oxygenation of a patient. An ABG measures the acidity or alkalinity or pH of blood and the levels of oxygen or O2 and carbon dioxide or CO2 dissolved in the blood, and more specific, arterial blood. An arterial blood sample is obtained from an artery, usually the radial artery, but it can also be taken from an artery in the groin, like the femoral artery, or inside the arm above the elbow crease, the brachial artery. See my video on 11 pulse assessment sites to learn about where to find the different pulses and the associated artery. I'll put a link in the description to that video. So now on to R.O.M.E. Not really, actually the R.O.M.E method.
So R.O.M.E or R.O.M.E. How does this acronym help us to assess ABGs? Well, let's take a look at the letters R.O.M.E. R.O.M.E is an acronym for R.O.M.E. R stands for respiratory, O stands for opposite, M stands for metabolic, and E stands for equal. So if we separate the letters in the R.O.M.E word, such as this, R.O. and M.E, it will help us to see this a little more clear. The R, or respiratory, this refers to the carbon dioxide or CO2 levels, which is controlled by the lungs. The O, or opposite, refers to the pH, which will be the opposite of the R. The M, or metabolic, refers to the 8CO3 or bicarb, which is controlled by the kidneys. The E, or equal, refers to the pH being the same as the M, or the metabolic or the bicarb. If the R in R.O.M.E is elevated, that would indicate that the carbon dioxide level is also elevated. Then if the O refers to the pH being opposite, it will then be decreased or acidic. So R equals elevated and O equals decreased. So if this was to occur without having any values to refer to this, we would already know that it is a respiratory acidosis. If the M in R.O.M.E is elevated, that would indicate that the 8CO3 level is also elevated. The E, referring to the pH, would be equal. The pH would also then be elevated or alkalotic. So again, if this was to occur without having any values to refer this to, we would already know that this is metabolic alkalosis. R.O.M.E or R.O.M.E, or respiratory opposite metabolic equal. Let's summarize this to ingrain it into your brain. If it is a respiratory issue, the values between the R and the O will go in opposite directions. Respiratory opposite. The pH decreases, then the CO2 will increase. Respiratory or CO2 equals increased, the pH or opposite would be decreased. If it is a metabolic issue, if the pH decreases, the bicarbonate will also decrease, would be metabolic equal. Metabolic or 8CO3, if it is decreased, we know that the E would be equal, or the pH would also be decreased. So in the RO, CO2 equals acidic or acid. So the CO2 would be elevated, the pH would be decreased, respiratory opposite, which would be respiratory acidosis. If the CO2 is decreased and the pH would also then be increased, this would be a respiratory alkalosis. With the metabolic, the ME, if HCO3 or bicarb is alkaline or base, and the HCO3 is decreased, then we know that the pH would be decreased also. That would give us a metabolic acidosis. If the bicarb or HCO3 is increased, then we know that the pH would also be increased, which would equal metabolic alkalosis. First, let's do a quick review of what an ABG is and what the normal levels in an ABG are. Because without knowing what the normal levels are in each category, then no method of ABG interpretation is going to matter, and there will be no way to determine what kind of acidosis or alkalosis is going on. It is important to commit these levels to memory. To make that easier, I created a song about ABGs, which describes about ABGs and what normal levels for each the pH, CO2, and HCO3 are, plus more.
Here's a new one by Nurse Master Charlie, the ABG song, plus more.
Because through rhyme and reason and music, memorization is easier. I'll leave a link in the description. Okay, so now normal levels. See part 1 for a more in-depth explanation of all these values. Normal pH is 7.35 to 7.45. Normal PaO2 or partial pressure of oxygen levels is 75 to 100 millimeters of mercury. Normal PaCO2 or partial pressure of carbon dioxide levels is 35 to 45 millimeters of mercury. Normal HCO3 or bicarbonate levels is 22 to 26 milliequivalents per liter. Normal O2% or oxygen saturation levels is 94 to 100%. Normal base excess levels are between -2 and +2 milliequivalents per liter. The three that I will be focusing on will be the pH, the PaCO2, and the HCO3. pH refers to acidity or alkalinity. PaCO2 refers to the respiratory system or the lungs. HCO3 refers to the metabolic system or the kidneys. A respiration is one inspiration and one expiration. In the inspiratory phase, oxygen is received into the body via the lungs and then enters the blood. During expiration, carbon dioxide is removed from the blood and into the lungs and then is removed from the body through the lungs. Normal pH is 7.35 to 7.45. Normal PCO2 is 35 to 45, and a normal bicarb is 22 to 26. Just a quick mention, if you notice, so as to make these numbers a little easier to remember, the 0.35 and 0.45 in the pH is very similar to the 35 and 45 in the bicarb levels. So I switched the PCO2 levels to make it easier to see. So all the acidosis values are on the same side and all the alkalosis values are on the same side. It doesn't matter how you do this as long as you know what the normal ranges are. So why does the high PCO2 move to the acidic side? CO2 is an acid. If a respiratory rate is decreased, the acid level builds up and lowers the pH. Remember, pH is inversely proportional to hydrogen ions. So if pH is decreased, then hydrogen ions are increased, meaning it is more acidic. If pH is increased, then hydrogen ions are decreased. So, ABG interpretation using the R.O.M.E method. So now for some examples. I'm going to ignore any type of compensation that may be occurring in these examples, as I will be covering that in part 3 of this video series. Example 1. We have a pH of 7.55, a CO2 of 44, and an HCO3 of 30. So in our example, the pH is 7.55, the CO2 is 44, and the HCO3 is 30. So the respiratory, or the CO2, is going to be normal. The O would reference the pH, which is going to be elevated or alkalotic. The M would be increased, which would also be alkalotic. The E, which the pH is increased, so the M and the E are equal. So metabolic equal, that the M and the E of the R.O.M.E equals metabolic alkalosis. So example 2, we have a pH of 7.27, a CO2 of 55, and an 8CO3 or bicarb of 24. In this example, the pH is 7.27, which is less than 7.35, so that is acidic. The CO2, which is 55, which is greater than 45, is going to also be acidic. The 8CO3 is 24, which is between the 22 and the 26 for the bicarb, so that is normal. So the R, or the CO2, is going to be increased or acidotic. The O, or the pH, we said is decreased, that is acidic. The M, we said the 24 and the bicarb is normal. And again, the E, or the pH, is also 7.27, it is decreased. So the R and the O are opposites of the R.O.M.E, so we have a respiratory acidosis. Example 3, we have a pH of 7.39, a CO2 of 40, an 8CO3 or bicarb of 24. In this example, the pH is 7.39, and normal is 7.35 to 7.45 for the pH, so that is going to be normal. The CO2 is 40, which a normal CO2 is 35 to 45, so that is also going to be normal. The 8CO3 is 24, which the bicarb normal levels are 22 to 26, so that is also normal. So if we look at our R.O.M.E, the R, or the CO2, being 40 is normal. The O, or the pH at 7.39, we said is normal. And the M, or the bicarb, we also said at 24 is normal. Again, the pH 7.39 is normal. Here we have a normal ABG.
I didn't put that last one in to trick you, just to show you what a normal ABG looks like. Because if you can recognize a normal ABG, then it will be easy to recognize an abnormal ABG. How did you do? Throw in some random values for the pH, CO2, and 8CO3 for added practice. Don't worry about any compensation at this point. I'll cover that in the next video, part 3. Also, be sure to see my video on part 1 on the tic-tac-toe method if you haven't seen that yet, so you can always see what that way is about. Then try them both out. After, leave me a comment as to which method do you prefer and which method do you find easier to use. Like I mentioned earlier, this is part 2 of what is looking to be a 4-part series. Again, be sure to look for part 3, which I will use the tic-tac-toe and R.O.M.E methods to determine about overall compensation of ABGs. So I presented the R.O.M.E method of interpreting ABGs to you and showed you a couple of examples to get you practicing. If you are interested in health information and nursing related content like this, I'd like to invite you to subscribe and be part of my nursing channel, and also hit the notification bell so you can be made aware of when I release new videos, like the upcoming parts 3 and part 4 of this ABG series. And don't forget to share this video, especially with those who want to learn about ABGs and also those who are struggling with ABGs, those of you who are in nursing school, starting nursing school, or are pre-nursing. Please be sure to check out my many other nursing topic related videos, which range from nursing assessments to the 5 rights of medication administration, as well as my nursing and health related music lyric videos here on YouTube. If you are not aware, I write and create nursing and health related educational music. So be sure to find my new ABG song here on YouTube and on all music streaming platforms such as Spotify, Apple Music, Pandora, Amazon Music, to name a few, to take it on the go with you so you can listen anywhere to keep you inspired, and you can be studying while listening. What a concept. Also be sure to check out my nursing blog on my website, www.nursemastercharlie.com. I post new nursing and health blog articles weekly related to what I share here on YouTube, Instagram, TikTok, and Twitter. So until the next video, go save lives and make a difference in someone's life. God bless and goodbye.
You can learn how to interpret ABGs with the tic-tac-toe and R.O.M.E methods. Arterial blood gas for the ABG measures blood acidity and alkalinity. Arterial blood gas for the ABG measures blood acidity and alkalinity. Arterial blood gas for the ABG measures blood acidity and alkalinity. Arterial blood gas for the ABG measures blood acidity and alkalinity. 7.35 to 7.45 in an ABG.